Morning, everybody. We're going to get started with just a few welcome remarks and introductory items, and then we'll move forward with our final day of the 2025 Wisconsin Enrollment Conference. Excited to have you back here, and there's just been such good content, and I know that today's sessions will be very much in the same excellent content that we've been seeing. So before we move into that, just a few reminders and some items. So similar to yesterday, we will or already have put in the chat the evaluation for yesterday's sessions. There it is. Thank you so much, Elizabeth. So please do take just a quick moment to give us your feedback on those. We definitely are looking at those and really super helpful. And definitely as we look ahead to next year already. Also, I think there might be either the same or an updated acronym guide. There you go. Boy, she's on it. Too many acronyms in this world, and yet we use them all the time. So hopefully this is helpful for you in just deciphering some of the terms that might be thrown around just without thinking. Happy to provide that. And that both of those also are on our website and the conference page for on the website. As we have done the last 2 days, we'll select our final gift card recipient at the end of today. So please stick around for that. And for those who are the recipients, we will be reaching out with more information and follow-up. So keep an eye out for that, but that will be our next step. Also, I wanted to mention that, and this is listed on the conference webpage, that similar to how we've done this in past years, for those of you who are familiar, we will have a special Q&A session run by our navigator program manager, Adam Van Spankeren. That will be this Friday at 1 p.m. The link for joining that, there's no registration needed, I don't believe. Just the link for joining that is on the conference webpage. And really that's, anybody can join. It's really especially geared towards those who will be taking the state state exam, who might be new this year. And just might have questions about content that we covered in this conference. And we're happy to just dive into some of that. And it's really just an open session. And so please do consider that if that describes you. Okay, well, I think those are my updates for today. Again, welcome. Really happy to have you and happy to have our speakers today. I'm going to go ahead and introduce our facilitator for the first session, Caroline Gomez-Tom. So she is, as you probably know, a staff member of Covering Wisconsin. She is in the Enrollment Network and Accessibility Manager role. And she is supporting 10 enrollment networks and community partnerships to help connect the community to Medicaid and HealthCare.gov coverage. Outside of her role with us, Caroline is also an elected Milwaukee County Board Supervisor, in which she currently serves as the chair of the Emergency Medical Services Council and the Intergovernmental Relations Committee. And she's the vice chair for the Health Equity, Human Needs, and Strategic Planning, and the Community Environment and Economic Development Committees. She's also a member of the Wisconsin Counties Association Board of Directors and serves on the City of Milwaukee Board of Health. She graduated from University of Wisconsin-Madison, where Covering Wisconsin is based, with a double major in political science and social work and a master's degree in social work with a concentration in social policy. So with that, I'm super excited to hand this over to Caroline, and she will get us started with introducing our speaker for this morning's session.
Thank you so much, Allison. And thank you all for being here today. I am very excited to be in your essence. I can sense all 238 of you on the call today, and I know a few more will be hopping on. I know the conference has been full of information, and this day is no different. We will be diving in to more policy, more upcoming changes that we can expect over the next few years. And of course, I'm gracious that we have our friend from the Centers for Budget and Policy Priorities, not once, but twice, Jenny Sullivan, to help us understand what those changes and upcoming expectations of this environment of healthcare that we're going to be in the next few months, year, etc. We know that there's a lot going on, and we want to make sure that we, as enrollment assisters, are stewards of good information, factual information, so that people can make the best decisions for themselves moving forward, and hopefully are able to maintain coverage in that mix. And so with that, I'm going to pass it along to Jenny, and she will take it from there. Thank you so much, Jenny.
Great. Thank you so much, Caroline. One moment. Let me get ready to share my slides. Let's do that one. Okay, and now I have to readjust my windows again because Zoom thinks it knows how I want them to look, but it does not. Okay. Nope. Okay, very good. So first I wanted to say, Caroline and I go way back, and I just wanted to say it's great to share space with her. She's been doing this work for forever, and I remember a fateful year. It was, I believe it was 2014 that I came up to Wausau, Wisconsin to do an in-person enrollment conference with her and probably many of you because it was my first real trip away from my newborn son at the time. So, and he's back there on a picture, and he's obviously much older now. So have known Caroline for a really long time, and it is just really great to be sharing the space with her today as we navigate yet another series of twists and turns with the Affordable Care Act. So if you were with us on Monday, thank you for hearing from me twice. But we talked on Monday about the landscape and the premium outlook for 2026. And today we are going to take a really deep dive into all of the policy changes that are being implemented before our very eyes, including right now, as well as into 2026 and beyond. Let's see. Okay. So I'll start with a brief overview. Always want to give you sort of a map to where we're headed today, and then we'll dig into each change in more detail. So, as you may be aware, there have been two major developments that are changing significant aspects of marketplace eligibility and enrollment. First, in June, the administration finalized their, quote, marketplace integrity and affordability regulation. The regulation was originally proposed in March, and it's not part of the annual cadence of notice of benefit and payment parameter regulations that the CMS does every year for the marketplace. This was sort of a one-off to implement some of this administration's new priorities. The regulation makes changes that took effect as early as August 25th of this year. And why August 25th? That was 60 days after the final date that the regulation was published, and the many provisions were just hung on that 60-day clock. And it also uniquely sunsets many of the changes at the end of 2026. We can guess on why originally they weren't sunset in the proposed regulation, and there were some interactions between the way that the proposed regulation was moving into the final process at the same time that the reconciliation bill was doing things to the marketplace. And so there are just some really unique things about how all these policies sit together. But second, in early July, Congress enacted and the president signed the Reconciliation Mega Bill, also known as the One Big Beautiful Bill Act. And this new law makes a number of additional changes to marketplace eligibility and enrollment policy, not to mention Medicaid. But the marketplace changes take effect as early as the 2026 plan year. So if you were following the bill as it made its way through Congress, you might recall that earlier versions of the bill would have written some of the provisions in the regulation into law permanently. Ultimately, this didn't happen, although I will note some cases where provisions in the regulation intersect with provisions in the law. So This morning, I will walk through the marketplace changes. There are a lot of different ways to sort of cross-tabulate this information. I think the chronological route makes the most sense to me, but you will have this slide deck and can sort of obviously make sense of the content in the way that works for you. But I will start with things that take effect or took effect August 25th and then move forward through the calendar. Okay, so this is, I'm not going to spend a lot of time walking through each provision on this slide, but I want you to think of it as your safety net as we get knee deep in walking through all of these changes. If you start to feel overwhelmed and go, I am losing track, there is too much going on here. This slide has all of the words in one place, and they're grouped by implementation date. And we've got an asterisk next to the provisions that the regulation sunsets at the end of 2026. And if you're looking for some stability, look to the box on the far right, which are some things that have not changed so far. That includes open enrollment dates for 2026. They will change in the future, but not right now. Tribal protections, the family glitch fix, funding of cost sharing reductions, which results in this thing we call silver loading, which increases the size of the premium tax credit for people as a sort of side effect, and standardized plans. The specific the specific amounts in the standardized plans are calibrated each year, so they're a little bit different, but standardized plans are still here, and plans still do have to offer them. Okay, and of course, as soon as I created this slide, I had to go in and make changes because about, 2 weeks, a week and a half ago, a judge halted implementation of a number of the provisions in the marketplace regulation. There are 2 major lawsuits right now challenging aspects of the marketplace regulation, and the judge ruled on one of those, and the provisions that have been stayed, so they will not be implemented right now until the case kind of makes its way through the courts. Those are highlighted in yellow here. I will talk more about these and what it means as we go through kind of provision by provision, but if you want a list of like what's happening when and which things are not being implemented right now, this is your spot, this is your slide. Okay, and then moving forward, never have I had to spend so much time talking about how a presentation is organized before I get into the content, but this is just the days and the times that we're living in. But these slides are coded, and I did this as much for myself as anything because I use this slide deck as a sort of Bible for referencing all the things I need to know about a given provision, and they'll be available to you to use in that way as well if it makes sense for you. Here's how it's organized. So the color of the banner at the top tells you whether the change is from the regulation or the law. Provisions with a yellow banner were made through regulation. Provisions with a blue banner were enacted via statute. That's important because regulations can get changed pretty easily, and administration can promulgate new regulations at any time. Things that are changed in law are much harder to change and will require subsequent laws if they were to be altered or overturned. So next to the banner at the top, there's a blue icon that shows whether the provision sunsets at the end of 2026 or is permanent. However, keep in mind that regulation provisions that are described as permanent can still be changed through future regulations. So I also recently created a new icon, that one with the gavel, to indicate provisions that are currently stayed by the court order, so not being implemented at this time. Every provision has a light blue box at the top describing the policy in place before the change is implemented. And then for every provision, there's a short description, the effective date, and whether it applies to all states or just a subset. And here you can see the provisions that are currently not being implemented due to the injunction. 3 were ruled contrary to law, and 4 were ruled arbitrary and capricious. The administration has appealed, but they only requested immediate relief on the changes to actuarial value. The Fourth Circuit, which is where the appeal rests right now, is unlikely to issue a decision on the appeal before the start of open enrollment, which means that the provisions that are stayed are unlikely to take effect at all in 2026. And some of them are sunset in 2026. So they have essentially been set aside. They won't ever see the light of day until this court decision makes its way through. But yeah, that's good for now. We'll get more into the details in a minute. So first, I'm going to start with changes that were scheduled to take effect August 25th or that will take effect for the 2026 year. And this is by far the longest section. So the low-income special enrollment period, as you likely know, allowed people with income up to 150% of poverty to enroll in a marketplace plan at any time during the year and to switch plans up to once a month, and there was no prior coverage requirement. The regulation eliminates the ability for marketplaces to offer an income-based special enrollment period, whether at 150% of poverty or any other income level. But this change does not affect the SEP for American Indians and Alaska Natives that allows these individuals to enroll in coverage year-round if their household income is between 100 and 300% of the federal poverty level. So the last day for enrollees in Wisconsin to access the low-income SEP was August 24th. However, this provision sunsets at the end of 2026, after which time a marketplace could, in theory, opt to offer an income-based special enrollment period again, but that does not mean that HealthCare.gov will choose to do that. And as I'll talk about in a moment, there are provisions in the reconciliation mega bill that make that a not very attractive option. So the new reconciliation mega bill also includes a provision related to SEPs, which says that people who enroll in marketplace coverage through a hypothetical income-based special enrollment period are not eligible for premium tax credits. They could still, in theory, a marketplace could still choose to offer a low-income SEP later on after 2026, but premium tax credits wouldn't be available to those people. So it would be highly impractical. People who have low incomes who can't get financial help are unlikely to be able to afford a marketplace plan out of pocket. This change does not have a sunset date, so this one is with us for the long run unless Congress were to take other actions. So for the first time in 2025, this year, people with DACA status have been permitted to enroll in ACA marketplace coverage and receive premium tax credits. This expansion of eligibility was supposed to be available in all states, but a lawsuit last fall precluded it from being implemented in 19 states, but Wisconsin was not among them. So this provision in the regulation permanently makes people with DACA in all states ineligible for marketplace coverage, full stop. Not just premium tax credits, no access to marketplace coverage, even at full cost. So the effective date for this provision was August 25th, and for HealthCare.gov states, these individuals will lose coverage effective September 30th. People that are affected by the change should look for a notice from the marketplace that will provide more details. And it's worth noting that loss of marketplace coverage does count as a qualifying event to enroll in other coverage that the person might have access to off the marketplace, for example, employer coverage. In most cases, this is either not available or not affordable, but nevertheless, technically, they do qualify. This is sort of loss of marketplace coverage is a triggering event. And here is the screenshot from HealthCare.gov. This just notifies people that DACA is no longer an eligible immigration status, and it directs people with DACA to select no when answering application questions about whether they have eligible immigration status. So if you follow enrollment policy closely, and I bet a lot of you do, you may be familiar with some changes that have been made in recent years to make it easier for people to enroll, even if federal databases don't have information about a person. This regulation change is currently stayed, so we've got the gavel icon in the corner here, but I'm going to describe it as if it were going into effect so that you have the information, in case it does, and in case we see these policies rear up in other ways. These provisions of the reg would require people to complete the data matching issue, DMI, resolution process, meaning they have to submit documentation before they can get their coverage. If no tax data exists about them, they haven't filed in the past, they don't have a job where they have been sort of in those in the payroll, or if the person attests to income greater than 100%, but data sources show that their income is below 100% of the federal poverty level. So these changes would have taken effect for applications submitted on or after August 25th. The provision also sunsets at the end of 2026. So if the stay remains in place, it will never be implemented. although the administration could certainly choose to include it in a future marketplace regulation, depending on how the courts rule. So a reminder that when people fail to resolve a data matching issue, they lose their premium tax credit and cost sharing reductions, but they remain enrolled in their marketplace plan until they actively terminate it. And that's just an important step as people are navigating the DMI resolution process, because we don't want people to get a bill in the mail for their full premium after PTCs have been terminated. And then just a reminder here, again, right now, this provision itself is not going into effect, but for any verifications of income, there's certainly a long list of financial documents that are qualified and that people can submit or upload copies of to verify their income. But sometimes situations are complicated. People don't have those documents readily available. There is a template online on HealthCare.gov that people can continue to use. This has not sort of fallen out of favor because of the current regulation. It's still available. People can still use it, or they can do the things that the template asks for without using the template itself. But it's basically submitting a signed statement describing your income, and that the person just has to include their application ID, their income, and the birthday for everyone in their household, and then the income projection that triggered the DMI, and the reason that the data sources and what they think their income are going to be are different. And we've gotten a lot of questions about this because self-attestation, meaning you put it on the application and the marketplace accepts it, is falling out of favor in this environment. But if you are asked for documentation, a certified or a sort of a statement, a letter of explanation is still acceptable. So just to clarify, self-attestation versus sending in verification, or sending in a letter of verification. Okay, on to the next change. So previously, when a person was in the process of resolving a data matching issue, they had 90 days to submit documentation, but the marketplace looked at sort of resolution rates, how many people had lost coverage for outstanding DMIs, and realized that it's not uncommon for people to need more than 90 days. And so in a recent regulation a couple years ago, they said marketplaces should grant an automatic 60-day extension to this 90-day period. This provision of the regulation permanently rolls back this protection in all states, and it only allows marketplaces to grant extensions to that 90-day period on a case-by-case basis. This provision did take effect for all applications submitted on or after August 25th. So, past due premiums. This is another example where the previous administration made changes that the current administration is directly reversing. So right now, insurance companies are prohibited from requiring people to pay past due premiums as a condition for effectuating coverage in a new plan offered by that issuer. This provision of the regulation would permanently reinstate this option in all states. Doesn't mean they have to do it. Issuers have to take advantage of it, but they could, allowing insurance companies to require people to pay up any unpaid premium debt with no limitation on the look-back period. The last time we saw this policy, there was a 12-month limitation. This one would have no limitation. And issuers could certainly put one in place, but they wouldn't be required to, before the issuer would have to allow the person to enroll in a new plan that company is offering. So people who are unable to repay their full premium debt could be refused coverage by that company, but they could still enroll in a plan offered by a different company if that was available. Although obviously no guarantees that there are other plans that are affordable and have the network that the person needs. Notably, states can, as I mentioned, institute their own policies around whether issuers are permitted to do this at all. So states have some power here, and under what circumstances, like how long the look back is required, is permitted, etc. But as you can see, we have that gavel again on this slide. This provision was due to take effect August 25th. It probably wouldn't have actually taken effect and effective plans until we got to the 2026 plan year, but it was also halted by this injunction, so it's not taking effect at this time. We talked about this a lot on Monday, so I will spend very little time on it now, but the reconciliation law was a big, huge tax bill, and it absolutely could have extended the premium tax credit enhancements. It did not. So by way of omission, I include this here as a provision or an omitted provision from the reconciliation law. As a result, as we all know, the premium tax credit enhancements are scheduled to expire at the end of 2025 unless Congress acts. Another change that was scheduled to take effect for the 2026 plan year, but was halted by the courts, is a $5 fee for certain marketplace enrollees who don't actively re-enroll in coverage for 2026. Now, this is not going to take effect for 2026, and it was a provision that sunset at the end of 2026, so this one may never see the light of day. But again, for purposes of policy understanding and the administration's intent here, I wanted to briefly walk through what this would have meant. Previously, most people who didn't return to the marketplace to update their information during open enrollment were automatically re-enrolled into the same plan that they had the previous year, or if the plan options were changed, they were mapped to a similar plan. And their premium tax credit amounts were updated using recent tax data. But starting this open enrollment period, what this provision would have done is say that people whose premium tax credit covers the full cost of their premiums, meaning they're paying nothing out of pocket from month to month for their coverage, who do not actively come back to the marketplace and re-verify their eligibility and actively re-enroll for 2026, would be charged $5 per month until they returned to the marketplace to update their information. We were really concerned about this because people who are paying nothing out of pocket this year don't necessarily even have, number one, having to pay anything when you're not eligible or not required to because your premium tax credit legally covers it. That's questionable. However, from a practical standpoint, even if the $5 isn't a problem, if people didn't have auto pay set up, which why would people have it set up if they have no premium this year, then they could really get in a bind because they could either fall into a grace period for failing to pay that $5 premium if they didn't know it was owed or didn't know how to pay it. Or if they were mapped to a new plan, if they didn't pay the $5 premium by the time that coverage was supposed to begin in January, then they could be locked out of coverage for the entire year. So, and we have no low-income SEP anymore, so this could be really penalizing very low-income people. Not a problem, but again, just wanted people to understand kind of the full scope of what the regulation contemplated. Okay, my slides are over here, that's why I keep glancing over here. So the next change, which comes from the new regulation, is the elimination of the bronze to silver re-enrollment crosswalk. Previously, people who were eligible for cost-sharing reductions, who were instead enrolled in a bronze plan where they don't get cost-sharing reductions, if they didn't actively select a new plan during open enrollment, then the marketplace was mapping them to a silver plan so that they could get cost-sharing reductions, which means lower out-of-pocket costs for them, if the silver plan had the same or lower premiums, and if the silver plan had the same provider network. This was just meant to be sort of, it didn't affect a ton of people, but it allowed people to sort of maximize the benefits that they were eligible for. This is going away for plan year 2026. People eligible for cost-sharing reductions who are enrolled in a bronze plan, who don't actively select a new plan during open enrollment, will just stay in that same bronze plan. This policy is set to sunset at the end of 2026, meaning a marketplace could adopt this sort of bronze to silver crosswalk again in 2027 if it chose to, but doesn't mean that HealthCare.gov will. There's sort of CSIO that sets the rules for all marketplaces, and then HealthCare.gov as its own marketplace makes decisions based on those flexibilities. So it's not to say that this is necessarily coming back after 2026. So the next change comes from the new law. Previously, lawfully present immigrants with income below the poverty level who were ineligible for Medicaid because of their immigration status were eligible for marketplace coverage and for premium tax credits. Typically, this included lawful permanent residents, green card holders, as well as other lawfully present immigrants subject to the 5-year bar, the waiting period before they're allowed to enroll in Medicaid. Beginning with plan year 2026, people in this situation will no longer be eligible for the premium tax credit. They could still enroll in a marketplace plan at full cost, but that's, again, pretty unrealistic for most people because by definition, these are people with income below the poverty line. This change is permanent, no sunset, period. The next change comes from the new regulation, and it's another change that's currently halted by the courts. Currently, ACA marketplaces are required to find a person ineligible for the premium tax credit if the person didn't file taxes and reconcile their premium tax credit for 2 previous years. After the first year, they get a warning, and then the second year, the marketplace withholds PTC until the person reconciles their previous advanced premium tax credits. So this provision would have tightened this standard to prohibit premium tax credits after just 1 year of failing to reconcile. Now, although this is unlikely to be implemented in 2026 due to the injunction, there is also a similar provision included in the law. So at the latest, we will see this 1-year failure to reconcile policy taking effect for plan year 2028. And I'll get to that when we get to 2028 too, but just to preview. So another change from the new regulation prohibits gender-affirming care from being included in the essential health benefits. As you probably know, the ACA outlined 10 categories of essential health benefits, things like preventive care, emergency care, prenatal care, that have to be covered by all marketplace plans. But it is up to states to decide which services fall under those benefit categories. The new regulation prohibits states from classifying gender-affirming care as an essential health benefit. States could still require plans to cover gender-affirming care, but the state would be responsible for paying for the part of the premium that would be expected to go to gender-affirming care. This change takes effect for the 2026 plan year and does not have a sunset date. Okay, now into some technical things, which I typically wouldn't include in a presentation like this, but because they affect affordability and there's some complicated things with the court activity, I did want to walk through them. So the new regulation makes changes to the premium adjustment percentage, a fancy word for or a fancy term factor that is used to set the maximum out-of-pocket limit for marketplace plans and also employer plans. The premium adjustment percentage also sets the required premium contribution for marketplace plans, which determines the amount of premium tax credit that people are eligible for. That's not counting the PTC enhancements, those layer on top, but this is a factor kind of below the surface that affects that expected premium contribution amount. So the Trump administration made a change to how the premium adjustment percentage is calculated that increases the maximum out-of-pocket, so people have a little less protection in terms of their out-of-pocket max, and it decreases the premium tax credit amounts by increasing the expected contribution amount. So under this new methodology, the maximum out-of-pocket limit for 2026 plans for an individual will increase from $10,150 to $10,600, and net premiums will increase by 2.7% because of the changes in the way they impact the premium tax credit size. This provision does not have a sunset date. The regulation also changes actuarial value standards to allow for less generous plans. Now, actuarial value is an often confused term and not something that we would ever talk to an enrollee about per se, but it is the way that you sort of compare the overall generosity of plans. So the 4 QHP metal levels, bronze, silver, gold, platinum, correspond to different actuarial value ranges. So for example, silver plans have an actuarial value of 70%, and that means that the plan covers 70% of the costs of medical claims for covered services for an average population, not for an individual, which is why we don't talk about it when we're doing enrollment appointments or helping an individual with their coverage, but it's sort of how the actuaries set up the marketplace. So under the new regulation, issuers can offer plans with a lower actuarial value, meaning that enrollees will be responsible for a larger share of their medical claims on average. Allowing plans with lower actuarial values is likely to lead to benchmark plans, the second lowest cost silver plan, with lower gross premiums, which will reduce PTC amounts. So again, hearkening back to what we talked about on Monday and how all these different factors are related and affect what somebody pays out of pocket. This provision does not have a sunset date. However, it has been halted by the courts. The tricky thing here is that this was in place when issuers were filing their rates for 2026. And so in its appeal, the Trump administration requested emergency relief on this particular provision. If the court does not grant relief, meaning they say, nope, you still can't do this, we are not allowing this, then CMS is likely going to allow insurers an additional window in October to come back and make more changes to their rates so that they comply with the previous AV standards. There is a link to a paper at the bottom here that goes through some examples and talks through this in more depth if you really want to nerd out on it. But I'll walk through one example here. So let's take Sandra. Sandra's 45. She is an EMT in Green Bay, and she's enrolled in the benchmark plan. She makes about $42,000 a year, which is 268% of the federal poverty level. Now, with all of these technical changes I just mentioned, and we'll assume that the AV changes take effect as well for these purposes, Sandra's annual costs could go up by more than $2,000 in 2026. So let's break that down. The largest portion of that increase, just over $1,600, would be due to the premium tax credit enhancements expiring. But she'll pay an additional $99 in premiums due to the payment formula changes in the regulation, and an estimated $252 more for the healthcare services she receives during the year because of out-of-pocket increases due to the actuarial value changes. So it's a less generous plan, meaning she's going to pay higher coinsurance and copays when she is getting care. Finally, she'll also see that out-of-pocket limit protection go up by $450 to $10,600. So this next change comes from the new regulation and is also currently halted by the courts. Again, for purposes of understanding, though, I will explain it. Currently in HealthCare.gov states, people who are looking to enroll using a special enrollment period for loss of minimum essential coverage are asked to upload documentation to prove that they qualify for the special enrollment period. This regulation would expand that requirement to more SEPs, and it would require people to upload documentation within 30 days of picking a plan. And this would apply to loss of minimum essential coverage, loss of Medicaid or CHIP, which is minimum essential coverage as well, the marriage SEP, the birth and adoption SEP, and the permanent move SEP. So a person's coverage wouldn't begin until they completed the verification process. This is one of those places where the marketplace would be getting rid of the sort of self-attestation aspect of eligibility. So note that HealthCare.gov is currently, right now, started doing it in May, requiring documentation to prove loss of minimum essential coverage. And it can do that as part of its flexibilities as sort of a marketplace. Again, this is not CMS saying this is sort of the marketplace as a marketplace choosing the flexibilities it's going to implement just for HealthCare.gov. So this change is scheduled to sunset at the end of 2026, but because it stayed, it might not take effect at all. We could see it come back, though, in a future regulation, so it's not necessarily gone for good. And you'll see in a minute that there are some changes contemplated in 2028 around verification that sort of dovetail with how this would work. So this is just a screenshot from HealthCare.gov showing that additional verification is needed to get the SEP for loss of minimum essential coverage. And the website notes that coverage doesn't start until the documentation is submitted. There's no pending situation where you can start your coverage and have a period of time to submit documentation. Nothing gets going until the documentation has been verified. So let's look at an example of how this would work, since HealthCare.gov is already requiring this kind of documentation for the loss of minimum essential coverage SEP. So here we are looking at Caroline. She's 28 and she lives in Madison. She had insurance through her job, but she learns she's being laid off at the end of March 2026. So she submits an application for marketplace coverage on March 15th and qualifies for a special enrollment period and for premium tax credits, but she's told she has to submit verification before her coverage can begin. Now she has 60 days from the last day of her employer coverage to use her SEP. Her SEP itself is 60 days long, but she has to submit verification of her loss of minimum essential coverage within 30 days of selecting a marketplace plan. So it's a faster turnaround there. She can meet the verification requirement by uploading a letter from her employer showing when her employer coverage ends. And the marketplace is going to review the documentation and send her a notice saying that she has successfully verified her eligibility. Now, let's just say for purposes of this example, that notice arrives on March 30th. The marketplace is going to tell her, it will enroll her in the plan that she chooses because she's verified that she is eligible for the SEP, but she has to pay her first month's premium by April 1st for her coverage to take effect for April. So things have to move very quickly for people to avoid a gap in coverage. And if the marketplace took a little longer, didn't clear her verification until April 1st or later, then her marketplace coverage wouldn't start until May 1st, which means she would have a gap in coverage. So it's not always up to the enrollee to move quickly. It's also kind of depends on the marketplace's timing as to whether the person will experience a gap in coverage. Okay, finally, this is just the finally for 2026 changes, then we'll have more, but finally, beginning in tax year 2026, APTC, Advanced Premium Tax Credit repayment limits are going away. So previously, if at the end of the year, someone's actual income ends up being higher than what they project or what they projected when they applied, then they have to repay any excess APTC when they file their taxes. Not the whole APTC, just the excess amount that they were overpaid, essentially. But there were limits to protect people from large unexpected payment burdens, which can happen. It's not just sort of negligence or people fibbing about their income. There are lots of reasonable situations where things don't square up at the end of the year, even though someone is absolutely trying to follow the rules and be as forthcoming as possible. So under the new law, starting in 2026, starting next year, people whose actual income is higher than their projected income will owe back all of the overpayment, all of the excess APTC that they received, no limits. Now, there is currently an exception in place in regulation, and those remain, that protect people whose income drops below 100% of the federal poverty level from having to repay. So that protection, if you follow the bill really closely, it was codified in the bill at one iteration of it and then ultimately pulled out at the end, but the protection still exists in regulation. And so it didn't really need to be in the law. Anyway, that protection is there if people's income goes down, which is really important because people who have income very close to the federal poverty level are more likely to have a variable income anyway. So we are happy to see that protection. But people will start to feel the impact of this change when they file their taxes early 2027. So the elimination of the APTC repayment caps means that in 2026, it will be really important for people to update their marketplace application if they experience a change in income mid-year or experience other life changes that could affect the amount of premium tax credit that they're eligible for, like a change in family size. As we talked about, I think a little bit on Monday, you can't just report a change and assume that your PTC will square up at the end of the year. It's possible that you have received more APTC in the months before you report the change than you are ultimately going to be eligible for the whole year, meaning that even though you're technically still eligible for the remaining months of the year for the APTC, you really should turn it off and not be taking more to avoid a repayment burden. And that's where you all are going to be so helpful in counseling people through these complicated situations where it's just not totally obvious what to do to protect yourself. So here, you can just see what the limits are for this year. So when people file their taxes in 2026 to reconcile their 2025 APTCs, you'll still have these protections in place. And then just a quick example to show why this is not as easy as just being forthcoming and having a really accurate income projection. So let's look at Gloria and Marcus. They're a married couple in their 40s living together with one child. Their income is $37,000, which is about 139% of the federal poverty level. Marcus gets a new job in August of 2026, and he gets employer-based coverage through that job. So the family dutifully switches to the employer-based coverage, and Marcus reports the change to the marketplace right away and terminates their PTC and their marketplace plan. So check, 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 following all the rules. And at the end of the year, due to that new job, the family's income is $70,000, which is a lot higher than they predicted when they enrolled in their marketplace coverage. So when they file taxes in 2027, they're going to owe back $2,264 in APTC, which is $314 more than they would have owed if the cap had been in place. So the cap didn't, eviscerate people's responsibility to pay back, but it provided some protection from really large paybacks, particularly for folks with lower incomes, and those protections will no longer be in place. So with that, we have made it to our first polling question, and the second section is much shorter, I will reassure you. But polling question, multiple choice. Which provision of the CMS final rule went into effect on August 25th? People with DACA status are no longer eligible for HealthCare.gov coverage. There's no longer a specific special enrollment period for people below 150% of the federal poverty level. C, there will be more verification requirements for income data matching. Or D, all of the above. Okay, very good. And almost everybody, as you often do, got it correct. The answer is all of the above. Those are things that took effect August 25th and are not currently stayed by the injunction. Okay, let's just take a few more minutes to go over the remaining changes coming in 2027 and 2028. So as you know, in recent years, HealthCare.gov has held the annual open enrollment period between November 1st and January 15th. The regulation makes a permanent change, which shortens the annual open enrollment period in all states. Starting next year, for coverage in 2027, HealthCare.gov states will hold open enrollment between just November 1st and December 15th. So a shorter amount of time and no time after the open enrollment or the automatic re-enrollment window to make any changes before open enrollment is done. And we see a lot of confusion about this because I'm guessing because the initial version of the regulation back in March would have started this change right away for 2026. But in the final rule from July, that's not changing till next year. Okay. And then finally, this last slide shows the remaining changes, which all come from the reconciliation mega bill, and they are all permanent. These are important things on the horizon, and although CMS hasn't issued guidance yet about how these will work, you're going to want to keep an eye out for more information about them in the coming months, and I'm sure covering Wisconsin will keep you all up to date as well. So in 2027, the law ends PTC eligibility for most immigrants in the country legally. I slowed down because it's such a big change. I want it to sink in. So this includes people granted asylum, refugees, people granted humanitarian parole, certain victims of domestic violence, and other groups. These individuals could enroll in full cost marketplace coverage, which would be highly likely to be unaffordable, but they will not qualify for premium tax credits. The only non-citizens who would continue to qualify for premium tax credits in 2027 and beyond are legal permanent residents, Cuban and Haitian entrants, and COFA migrants. Next, 2027 is also the year when states that have expanded Medicaid will be required to implement a work reporting requirement for people enrolled in Medicaid expansion. Now, I know Wisconsin is in a different place with the way that coverage works for adults with low incomes, and you haven't technically expanded, but just to note that if people are not in compliance with the work reporting requirement, either because they haven't worked the hours or they haven't successfully done what the state requires to comply with the requirements, they will be ineligible to get premium tax credits for marketplace coverage. So the marketplace will not provide a safety net for those individuals. Starting in plan year 2028, and this is like a little blip at the end of a presentation, but this is all we're going to be talking about in about a year from now, because this is a huge change. But the law requires all states to implement new eligibility verification requirements for premium tax credits. And I said states, I really should say marketplaces. People will not be allowed to enroll in coverage with premium tax credits until they have verified household income, family size, immigration status, eligibility for other health coverage, place of residence, and quote, any other information that may be identified by the secretary. Now they can use data sources, but people have to actively come back and say, yes, that's right. Yes, that's right. No, that's wrong. And here's my verification for what the new information is. The only exception to this requirement would be for people who are enrolling during a special enrollment period due to a change in family size. There was some advocacy during the when the bill was working its way through Congress, and was convincing enough that when people have a newborn, they should be able to get that newborn enrolled right away, not waiting for verification processes to work their way through. The law also requires marketplaces to set up a system for people to verify their eligibility for premium tax credits annually, starting August 1st, prior to the new plan year. So everybody would have to come back starting August 1st, verify or update their information. And if they didn't do that, they don't qualify for premium tax credits. And what this essentially does is eliminates automatic re-enrollment. Everybody will be required to actively re-verify their eligibility every year before they can continue receiving premium tax credits. And then finally, as I mentioned before, the law has a requirement separate from the requirements in the regulation that are currently stayed that requires marketplaces to adopt 1 year failure to reconcile starting with the 2028 plan year. See, now you're wanting to go back to that slide that's supposed to be calming and centering, right? With all the things in one place, because this is a lot of content. But you saw this slide on Monday. I just want to reiterate, this is going to be a lot, and it is going to trip people up, and people are going to need help. And some of the things we can do are just to help people navigate through the process and to stay vigilant, to stay engaged. And if they're eligible, fight a little harder to keep their coverage, which is an unfortunate position to put people in, speaking from the eye, but it's a tremendous service that you can do to the community, for the communities that you serve. But I don't want to suggest that if we just do these things, then everything will be fine. This is going to be a challenging year. So with that, I have gotten through all my content, and we're ready for our second polling question, which is true or false. The open enrollment period for 2025, meaning for coverage next year, but that's happening starting this year, is November 1st to January 15th. True or false?
And we'll want to keep it open for a little longer this time. I think the first one went quick. I want to make sure a good consensus of folks can respond.
Let us know you're paying attention.
Oh, people are paying attention. We have a lot of questions to go through.
Uh-oh.
All right, I'll give it like 10 more seconds. All right, let's go.
Right. True. Open enrollment for next year goes all the way through January 15th of 2026. So very, very good. And if you missed that one, now you know, and you're all set. It's good news. So with that, I think we're ready for Q&A, or I'm ready for Q&A.
All right.
Ready as I'll ever be.
So I want to thank my colleague, Cheryl Isabel, for helping facilitate the Q&A section, and she was helping us organize. So I'm going to go through some of the questions that she said if we could answer them live. All right, so the first one that I see here, would the DACA recipients that lose their coverage need to complete a new application or just report a life change? So maybe talking a little more about with folks who recently found out they're no longer eligible as of August 25th, what that looks like in transition, because we did get some updated information from CMS right before that reg went into place.
Right. You should check me, because I think that you have you are more versed in some of the details and the application mechanics. But those people with DACA who are currently enrolled in a marketplace plan, their coverage will end. They don't have to take any action. It's just going to go poof at the end of September of this year, September 30th. If they, have an option through an employer, or if they have another option off the marketplace, then they can, this is a triggering event to allow them to enroll outside of those plans' open enrollment period. And if you're assisting somebody in this situation, if it's possible for them to move to a plan offered by the same issuer off the marketplace, then that could be an attractive option if they've used services this year, so that their accumulator, so to speak, what they have already paid in healthcare services toward an out-of-pocket max or a deductible, can be swung over to a different product that's offered by the same insurance company. Anything you would add to that?
I would just add that, we didn't know essentially what that transition was going to look like. So when they gave us that notice that, they would have coverage through the end of September for the folks that currently had HealthCare.gov coverage, that made more sense in the way that probably meant that the qualified health plan would then essentially have some kind of ping from the marketplace to then send out a notice so that folks knew when their last day of coverage would be. Because initially we were worried that it would just end and that was it. But I think extending it to that September date allows for some of that normal transition information to get out to the individual. But the folks that weren't already signed up on healthcare.gov, we believe that as of August 25th, they are no longer able to enroll in coverage.
Correct.
All right. And Jenny, if you wanted to stop sharing your screen just so
Oh,
that.
yes, I forgot that that was still up. I'm sorry.
No, you're good. So then
Thank
they
you.
can see your lovely face. All right. So the next question that was for you, it says, can you explain the regulation changes that sunset? Are they sunsetting because they were codified into law under the budget bill? In other words, are they not actually sunsetting in practice?
That is an excellent question, and the answer to it would have been different at different points during this summer as this law as this bill was making its way through the legislative process. Ultimately, trying to think if there's the two things that are sort of in the reg and also in the law are the changes around the low-income special enrollment period and the changes around failure to reconcile. So there are things that happen in the law that are not affected by any of these court cases because they are the law and haven't been challenged, and they will take effect. The things that were sunset, we don't know. There's some speculation that originally they thought, okay, this is going to take, we'll pass the torch, so to speak, to the law, and they will carry these provisions forward. And then when those got stripped from the law, there was a question about whether this was done for budgetary reasons around the marketplace rule and sort of the overall how much the Congressional Budget Office would take from the marketplace rule and say was the impact of that rule, and then potentially implications for how the Congressional Budget Office would score the law. At the end of the day, I think those are questions that unless you have an inside scoop at CBO and within the administration, we may never know the answers to. But the combination of the court injunction and the sunset does mean that many of these provisions are never going to see the light of day unless or until the administration or Congress takes additional actions to put forward different regulations or pass a different law.
Thanks, Jenny. And this might be some additional forecasting, but should we expect any other potential changes to come through? Because I know that they're going to be working on another budget bill at the end of September to avoid government shutdown. Is that right?
Yep, yeah, that's absolutely right. Right now, the federal budget goes through the end of September. And so we've got a ticking clock around that. And sometimes when Congress has a deadline, things can get interesting and touch lots of different programs at the last minute. We don't know if premium tax credit enhancements, for example, could get rolled into that. We don't know if Those who want premium tax credit enhancements might have to bargain down from what they are currently or give things up in order to get those included, or if there's just a closed door and those can't get included at all. This is the kind of stuff you can read in Hill newspapers that changes sort of on the hour what people are prognosticating. But that's a possibility. The other thing to keep an eye on, though, that's a little more predictable is the next notice of benefit and payment parameter regulation. We typically see those at the end of the calendar year for 2 plan years ahead. So we'll be looking at the notice of benefit and payment parameters for 2027 coming from CMS towards the end of this calendar year. And that, who knows what we may find in that.
Absolutely. And folks have probably heard me talk about this, but it's important to know that what we see in the news is maybe something that could be coming, but it may not be in effect as of today. And so being connected to us at Covering Wisconsin, to CBPP, it's important to know kind of what's happening in real time so that we're able to give community members the best information possible. So I just want to reinforce, stay connected, please, with us, because I know the news can just be overwhelming at times. All right, we have a few more. So let's see. Has Wisconsin made a statement about paying for gender affirming care? And I could maybe address that question. So we actually had a fantastic session yesterday around LGBTQ plus services and healthcare, and we did address some of the questions regarding gender affirming care, and that session is recorded, so you can go back and watch it. Additionally, Wisconsin has never had gender affirming care in our essential health benefits package. However, there is policy around discrimination in that if someone is offered a certain healthcare service for other reasons, that service should also be then covered for someone who is transgender. And there are ways to, if that's in question, submit a complaint from on the insurance company for not continuously giving you that same level of care with the Office of the Commissioner of Insurance. All right. So then we learned yesterday, that's a similar question around gender affirming care. Let's see. Okay, so this one is, I always get caught up with the actuarial value questions. So the changes to actuarial values could make it so that plans are no longer 60-40, 70-30, 80-20, 90-10. I'm guessing they're referring to bronze, silver, gold, platinum.
Right. They change those values. And I wish I had the paper that I referenced in the slides goes through this in more detail, but what the regulation does or would do if the stay is lifted is make the ranges lower. So that on average, a plan could qualify for a silver plan if it covered fewer than, by sort of a small but not insignificant margin. I'm sorry, I don't have the exact factors in front of me, but your general understanding of the premise is correct.
Yeah, and I think too, when this is something when we look at the plans, when the examples are available through, the C plans tool, we're able to really dig into kind of like what those impacts look like. So, and that was one that was halted, correct?
Correct.
Yep.
It's halted, but that's the only one that the administration said, we don't want to wait for this to work its way through the courts. We want emergency relief on this because the plans that have filed their rates, they have included this provision in it. And if you say that they can't include this provision, then we have to open up the rate filing window again and let plans make amendments. So it will be an exciting fall.
All right. So I know we have a few more questions. Allison, how long can we go till, or are we at time?
Yeah, we're pretty much at time. I would say we could do one more question and then we'll need to wrap it up.
Okay. Well, so I'll take one more question then. In the example about special enrollment verification, What if they paid their premium for April? Their documents are not approved until April 2nd, and then their coverage begins May 1. Will they need to request a refund from their insurer? This could affect a lot of people.
So the marketplace is not going to say, hey, insurance plan, I'm sending you this person until you verified. Now, what I don't know, it's an excellent question, and it makes me wonder the mechanics of this and if somebody could enroll without a PTC and say, hey, I would like to enroll because I really need the coverage, and if I really have to, I want to pay the full premium in April, and we'll get this PTC stuff sorted out and start that in May. I don't know if that is something that is possible. And I would love to hear back from you all as you're assisting people in these situations in terms of the mechanics of what is permitted. But this is new and it is causing some disruption. We've definitely heard of people with unexpected coverage gaps that they wouldn't have had before because of the way this is being implemented.
Absolutely. I think that's one of the things that I try to reinforce is that policy does not equal reality, and it will actually take us as enrollment assisters on the ground seeing these things in full effect to really understand how they impact people. And then we, redact personal identifiable information, but then send them to, you all and partners like you, where we're then able to share with other partners so that we are able to get a better handle on how these things look. I want to thank you so much, Jenny, for both sessions, for today, for your knowledge, your expertise, and your friendship. You have been always a wonderful friend and partner to Wisconsin. And I'll transition it back to Allison. And I hope you all have a great rest of your conference and great rest of your day.
Wonderful. Thanks so much, both of you, Jenny and Caroline, for hosting the session, and for Cheryl for monitoring the Q&A in the background. Yeah, so much information, and we really appreciate Jenny and really the CBPP partners and team for tracking that super closely. It really matters. All right, we're going to take a break. We will be back here at 9:50. And we'll wrap up with our final session of the day. Thank you.